Hello, my name is Gabriel Scott Bugler, and today I will be discussing the impact of colonialism on health in Mexico. So, an introduction to colonialism. The definition of colonialism is the practice of gaining control over another country, occupying it with settlers, and exploiting it economically. Colonialism has had lasting impact on Mexico's health outcomes by establishing economic and social structures that persist today. The Spanish colonial period introduced economic explanation, social inequality, and cultural suppression, which created the foundations of disparities that continue to this day. So, a brief history of colonialism in Mexico. The colonial, colonizing power was Spain, and the colonial period was roughly 300 years. And some key events in the history were the fall of the Aztec Empire by Spanish conquistadors, forced labors, and the economía system, spread of European diseases, drastically reducing the indigenous population, and the establishment of Spanish social structures, which influenced Mexico's economy and social systems. So, the encomienda system and its health implications. The encomienda system was a Spanish colonial labor system that forced indigenous people in Mexico to work for Spanish settlers, often under brutal conditions. It led to malnutrition, poor living conditions, and limited access to healthcare. It has also been linked to long-term health effects and socioeconomic disparity in Mexico today. The figure kind of shows you a social structure of how that might have been set up, an example of who was at the top, giving orders and enslaving the people at the bottom. So, um, spread of disease and population decline because of um, colonialism as well documented. The destruction of native populations and communities during colonial times has had lasting effect on the public and social structure in Mexico by creating deep-rooted inequalities and disrupting traditional support systems. The drastic the disruption of this has had lasting health effects, and we will kind of go into that further. So, some present day health challenges in Mexico. There are high rates of obesity, diabetes, and cardiovascular disease, especially among indigenous and rural communities. Historical economic structures established during colonial times significantly has contributed to this, and also contributed to limited access and to healthcare in rural and underserved areas. Um, this can kind of be attributed to the populations that were forced into labor with little opportunity for economic advancement. This created a lasting class divide that we see now today. And more of a connection of a statistic that I'd like to highlight is that as of 2023, 20% of Mexico's rural population lacks access to basic healthcare services. So again, that kind of divide that was created during colonialism is still present today and has serious implications on population health, especially of ones in rural areas. So, socioeconomic impact um, and inequality uh, that we have experienced because of colonial. So the colonial economic structures in Mexico prioritizes resource extraction and the enrichment of Spanish elites. And that inequality affects access to healthcare, education, and nutrition today. A kind of statistic to highlight that would be Mexico ranks amongst the most unequal countries in terms of income distribution, with the top 10% holding a 42% of the nation's income. So then again, this kind of distribution and divide in wealth is seen not only from colonial times, but now is persisting to this day, and again has broad implications and impacts on Mexico's health. So let's look at some remediations. I think one remediation is to promote indigenous-led health initiatives. I think encouraging health programs that are developed and led by indigenous communities are very important, and they reach people in ways that traditional health services maybe cannot or don't or not successful in doing that. They ensure that these initiatives respect and incorporate traditional practices, which is very important and crucial even to the success uh, of these programs and initiatives. And some examples would be to support policies that allow Indigenous communities to have more control over their healthcare and wellness strategies. That looks like resources, you know, communications where they're in control of that, and their needs, and kind of just everything along those lines. Obviously, there will be, you know, some crossover between Western traditional medical practices, but I think they should definitely incorporate and promote Indigenous health initiatives and positive outcomes for this population. So the remediation recommend the remediation recommendation number two that I had was addressing socioeconomic inequality. I think focusing on reducing income inequality as a means to improve access to healthcare is very important. I think, as I have shown, that once there's a large divide, the divide not only is monetary, but it also is health outcomes, obesity, malnutrition. You know, a lot of these health conditions are very much tied to socioeconomic uh, themes. So some examples would be kind of implementing progressive taxation and investing those taxes into healthcare infrastructure in rural areas. So that could look like more taxes for richer individuals and kind of a progressive taxation based off of income. I think a statistic is that studies show that countries with lower income inequality have up to 20% better health outcomes. So I think that addressing that will be a huge step in the right direction. Um, so remediation recommendation number three that I have is kind of decolonizing health education and training. I think kind of plays into the last two remediations that I mentioned, that the reformation of health education should include Indigenous perspectives and traditional medication when necessary or when possible. Obviously, that's not always the case, but definitely when applicable, it would be beneficial uh, for this type of reform. I think training healthcare workers to be culturally sensitive and knowledgeable about local health practices is very important. Again, incorporating local and traditional knowledge into these trainings is very crucial, and you know, we want public health campaigns to reach everyone and to have a positive impact on everyone, and I think doing that can help ensure that. I think an example would be introducing curriculum changes in medical schools and to provide incentives and additional support for healthcare workers in rural areas to help bridge that gap. So I think an interesting example of a successful decolonization effort can come from a case study. And in this case study, there is a successful example of decolonization. And the example is Casa de la Mujer Indígena, and it's a program in Mexico. And this initiative was launched by the Mexican government in collaboration with local indigenous communities and aimed to improve maternal and child health by integrating traditional health practices with modern medical care. The CAMI project demonstrated how decolonizing health systems by integrating local knowledge can improve health outcomes. And if you'd like to learn more about that, the source is there. But a very interesting case study and kind of an example of what I was speaking to earlier. So some key takeaways from this presentation is that colonialism in Mexico established economic and social structures that marginalize indigenous populations, and it led to long-term health disparities, especially in rural areas. I think these structures created inequalities in income, healthcare access, education. I think some modern health challenges that are more relevant today are chronic diseases and limited healthcare access, and these are definitely linked to colonial exploitation and the results of large socioeconomic disparities. I think decolonizing health practices and policies is very crucial. integrating indigenous knowledge, empowering local communities, investing in local communities, and addressing structural inequalities is just absolutely paramount to build a more inclusive and resilient healthcare system. In conclusion, I think addressing colonial legacies is essential to building a healthier and more equitable future for all communities in Mexico. Acknowledging and dismantling these historical inequalities are just as important um, as working on new initiatives and new programming. I think supporting Indigenous voices in the healthcare field, especially in ones in rural communities, fosters resilience and empowers communities to reclaim their cultural practices and health knowledge. And I think overall, integrating these voices not only improves health equity, but it also strengthens the overall well-being of society, which benefits everyone. And I think that honoring the diversity and wisdom within local communities is important and very important in marginalized communities. And I think overall, acknowledging these themes that I spoke upon are crucial. And I think that some of the remediation efforts kind of stem from that acknowledgement and that understanding, and then can work from there. And yeah, that pretty much sums up my presentation. I hope this was impactful and beneficial to everyone's learning. And yeah, I hope everyone that watches this has a good rest of their day. Thank you.